I'm going to invite all the investigators up to this here. I'm so happy because I was the investigators in Toronto. So nice to see investigators here in Vancouver.
So many friendly faces.
I know.
Hi everyone. Can you hear me all right with this? Yeah. So my name's Jeff Morgan, and I coordinate the Investigators program here in Vancouver. And because this is the Investigators, and because we do things a little bit differently with the Investigators, we're doing this presentation a little differently as well. So we've taken 2 spots, so we have about 40 minutes to spend together today. We've locked all the doors. You have to stay here the entire time. So just thinking about, combination prevention, innovative approaches to combination prevention. Oh, thank you, Eugene. We're presenting our innovative approach of studying combination prevention, which is our investigators model of community-based research. So here we will be presenting a guided discussion with 4 of our investigator co-researchers here. And with that, I'll let them introduce themselves, starting with Scott.
Hi, I'm Scott McLaren. I actually got involved in the Investigators program through the Totally Out program, which was mentioned in the last presentation. And I've been involved with them for just a little bit over a year. I'm an engineer by training, so being involved in gay men's health research is very different from what I do for my day-to-day job, so I'm so glad to be here.
Hi, everyone. My name is Hrvoje. Yeah, it's Hrvoje. I'm from Croatia. I actually moved here about a year and a half ago. I've been an investigator since March. I really wanted to join just to expand my circle of friends here in Vancouver. And I did study sociology back in Croatia, so I also wanted to get back into research, which was also one of the great motivators here. So, one more thing I want to mention. I also found out about Totally Outright through CBRC, so through Darren, mentioned that. And that was also an amazing experience, so thank you.
Hi everyone, my name is Kevin Estrada, and I've been a part of the Investigators for about a couple of years now, and what really drew me to it was the fact that I could meet other like-minded guys in a non-sexualized space and really be able to do work in the community that I'm a part of and I'm able to serve in as well. And it's really rewarding. Justin.
My name is Justin Barath, and I've been with the Investigators for almost 3 years. I moved to Vancouver 4 years ago, and sort of learning about this program was a great way to meet new people in an area that I was interested in pursuing. And I've stayed because it's been such an awesome and rewarding experience over the last few years, and I hope they will keep me around.
Absolutely. We also want to acknowledge some of our colleagues who participated in this research as well, who are in the audience, including Leslie, so big shout out Leslie, as well as Ian McClellan, Henry Wu, Aidan Ablona, as well as some of the friends of investigators who are in the audience as well today, some of our research mentors who I won't say right now, but you know who you are, so thank you.
So just to walk everybody through with what we're going to present today, we're going to give you an overview of who we are and who we work with, a rationale for why we wanted to study PrEP in our community, and we'll walk through how we've done our data collection, analysis, any preliminary findings that we found so far, reflecting on our own experiences doing community-based research, and any recommendations and next steps that we'd like to suggest. Jeff?
So maybe just quickly, who's heard of Investigators before? There's a lot of branding at the summit this year. Okay, so a lot of you, that's awesome. So the Investigators is a program that's obviously very near and dear to my heart. I started as an investigator actually in 2015, and I've started coordinating the program since 2016. The program itself started in 2011, and it's really one of CBRC's cornerstone programs, a capacity building initiative, really aimed at networking and connecting young queer men with research mentors and community mentors. And we really try to participate at every step of the research process, from consultations to development of study tools, data collection, analysis, all the way to knowledge translation like we're doing today, and some campaign development as well. So I just wanted to pass over to the guys, and maybe each of you could say something about what you've liked about Investigators, maybe how you've gotten involved, and what it means to you. Scott?
Yeah, so I got pitched the Investigators program, as I said, at the Totally Outright program. And for me, I really have always enjoyed data access, and the ability to access data through the Investigators program has been so interesting, just to get a really good feel for the needs of the community, and for me, like, how can we turn this data into actual action has been such a great opportunity.
For me, I found out about the investigators through CBRC, and it was actually funny because I found there was an ad on Facebook talking about the new CBRC's office, which was a block away from me. So that's where I met Jeff, and he told me about the investigators. And what really intrigued me was being able to learn about how to do research from start to finish, and again, meet other guys who are like me, who are interested in the same topic. So, yeah.
Yeah, and I think for myself, with what Jeff mentioned previously, it's about capacity building. I think when it comes to gay men's health research, it's important for us to have those intergenerational connections and making sure that any knowledge that we have when it comes to gay men's health, that we pass it on to younger people and next. So I feel like that's a responsibility and duty and stewardship that the investigators have and in serving their own community. So I think that's something that's really exciting to be a part of.
So beyond the social aspects of the program, when I moved here after university, I was a little bit lost or maybe in an exploratory phase of my career, and so I wanted to try and do as many things as possible and get exposed to as many different opportunities. And so the investigators seemed like a great way to get involved with research and meet knowledge experts. My small plug, which is I have a new job because of the investigators program. So I graduated university with some degrees in science, didn't really know what I wanted to do, got some experience with research and using the data and some soft statistical analysis, and recently got a job at the Center for Excellence as a data analyst. So you can go places with the investigators.
Join the investigators, and we'll get you a job. So the picture here is kind of a fun one. Kind of like almost like a typical day, us doing arts and crafts that is involved with, I always say community-based research is like 50% arts and crafts. So this is us working on the Sex Now survey and kind of tearing apart previous iterations of the Sex Now survey and lumping them into themes and really just exploring with our hands what other iterations of the survey have asked before and what are some common themes, and that was kind of a fun day.
Yeah, so these are two examples of projects that we've engaged in the past year. They're both related. The first was actually the Saturday session at the summit last year, which was the community consultation for the Sex Now survey 2018. This was a really valuable experience for me because I found that getting that qualitative and community experience through interviewing folks who don't necessarily come out to maybe research groups, or we don't go out to them, you know. There was a lot of intergenerational knowledge sharing, and I think that was one of the most valuable things that I took away. And everything that we learned actually went into the design of the Sex Now survey, which we ran physically during the summer and will be posted online shortly.
So the other project that we did was for this year doing our in-person Sex Now Pride data collection. This was a photo from the Vancouver Pride, and this was kind of the first boots on the ground effort for us actually getting data from the survey that we spent the last so many months actually putting together. And for this, as many know, we did our dried blood spot collection. So even to just do this survey, we all had to go get biohazard training, which isn't exactly what you first think when you're doing a study. But it was so great to really get to put faces to the community that you're trying to serve by getting better information about what they really need. So it was a really valuable experience getting to have that, just getting face-to-face with the community.
What was it like getting those dried blood spots from folks?
It's a lot harder than you'd expect. Some people bleed really easily, which is great, and some of them don't. But the best part was these people wanted their data to be collected, and they're like, please, like, prick me again. Like, let's yeah. It was so awesome. People wanted their voices to be heard. It was such a great experience.
Cool. So I think we're going to maybe discuss why we decided to study this topic of PrEP and why we wanted to do this in a way that was community-based. So I'll hand it over to the guys.
I guess I can start. So PrEP started to become increasingly part of daily conversations that I was having with friends. And every time we would meet, it seemed like it kept becoming more prevalent as things that people were talking about. In addition, on Grindr and various online apps, I would start seeing things like negative on PrEP or some variant of that was becoming increasingly popular. And so it seemed like a great opportunity to study something at the beginning, especially because now that it was publicly funded, it gave us an opportunity to hit the ground right at the beginning and assess how we're doing with this program at a community level.
So for me, it was more personal in the sense that I was previously in a zero-discordant relationship. So learning about PrEP was something for me to really be able to actualize and realize and how I can take control of my own health. And I also went through the process of accessing PrEP before it was publicly funded. And it was incredibly difficult having to deal with bureaucratic processes and different wait times and things like that. So I think now that it's become a little bit easier for everybody else, there's still an investment that I have in the development of efficient referral pathways and service delivery for guys who are interested in accessing PrEP.
So in Croatia, we don't even have PrEP. It's not readily accessible. And I heard about it through my American friend a few years ago. So that made me interested. And after coming here to Canada, I actually learned about PrEP through Totally Outright. And what I wanted to know more about is how PrEP is influencing young and pretty much any all gay guys and gbMSMs, how it's influencing their life and their sexual habits. So this gave me an awesome opportunity to actually look into it. And seeing that this is a qualitative study, we also could actually learn about their experiences in depth. So that was my main motivator.
For me, it was kind of two major reasons. The first reason being PrEP is kind of the new shiny toy that everyone's excited about, and how could you not be excited about it? It's something that could be generation defining, especially because now that we have provincial funding. And the other side for me is that I come from a very quantitative research background, and to get involved in a qualitative study was something that would be really interesting to get better experience in.
Yeah, like in addition to all the points that the guys made, like obviously January 2018 became publicly funded for queer guys in BC, so we really knew it was like a really important time to start exploring this. And we have a lot of colleagues and friends over at Health Initiative for Men, and speaking with them, we realized that a really disproportionate number of folks were accessing PrEP through HIM health centers. We knew there's something kind of special or unique that was going on with this sort of model of care at the HIM health centers that we're really interested in exploring more. Secondary, we know that in order to be one of the steps to get on PrEP is something called the Jiri Score, which is basically like a risk assessment tool. And some of these questions that the Jiri Score asks are really personal in nature. They're asking about substance use, crystal meth use, how many guys you're sleeping with, or whether or not you bottom or top. So we know that these sort of really personal questions might not be something that guys were really used to speaking about in a clinical sort of interaction. So we're interested to see how the introduction of this Jiri Score may have impacted the clinical interactions as well. So to accomplish this, we were really, really fortunate with partnering with the folks over at UBC. This was a sub-study of an existing project by Rod Knight and Jeannie Shoveler. The ethics we obtained through UBC as well. And to kind of learn about qualitative research and to get us to where we needed to be, we participated in a series of interactive participatory workshops that really guided the development of this project. So some of the workshops that we did included developing a research question, some qualitative interview skills, how to develop a qualitative interview guide. We learned about Nvivo, data management software, and about thematic analysis as well. And we actually also have some opportunities for sustained collaboration as well going forward with Rod's team as we continue with data collection. So before I thank everyone, I just want to pass over back to the guys, and maybe a couple of you could speak about what were some of your favorite workshops that you participated in.
So yeah, as Jeff mentioned, we were able to get a hands-on approach on how to do such a research project from start to finish. So we really managed to do both working on first the research question, then on the interview guides, which is very interesting. And for me in particular was the Nvivo and coding and actually analyzing the data, which was the most interesting part. I had never before actually worked on Nvivo. And it was really great to find themes that were occurring, which you will soon hear about as well. So just analyzing the data and having some of the mentors that are present here, which is a very rewarding experience.
Cool. And with that, we just want to say a huge thank you to Rod and Anna and Caroline, Olivier, Natasha, Michelle, Simon, Ray, and everyone else at Health Initiative for Men for your help in doing this project as well.
That's me. So through this process, as Jeff mentioned, one of the things that we worked with Rod's team with was designing an interview guide and really getting to the questions that we wanted to answer. And so through this process, we identified 3 research objectives, which you can read on the slide. The first was really about identifying experiences of gbMSM accessing PrEP at the HIM health centers. So guys who actually go there, what was that process like? Was it positive, negative, all that sort of feedback that we could gather using our connections with these great community partners at HIM. The second was understanding how the introduction of the Jiri MSM screening tool changed clinical encounters. So as Jeff mentioned, Jiri scale or the score is simply one of the sort of screening tools. It's a risk assessment, and a lot of the questions on there are very personal, and they ask things about substance use and sexual behavior, things that we figured most guys wouldn't have been asked by either their doctor or a nurse ever before. And so we were interested to see if that changed how they interacted with their doctor. The third was exploring factors that influence decisions related to where gbMSM choose to access PrEP. So what made a guy go to him versus maybe going to his own family doctor? That was really important to us because it was outcome driven. We wanted to learn if there was something that we could develop that would take some of the pressure maybe off Health Initiative for Men and educate more people, more doctors out in the community so that the capacity was sort of increased everywhere and demand at him could be reduced, hopefully.
So for our study, our biggest, I guess the central part to our study was our interviews. It was going to be a semi-structured interview with one of the investigators and with one professional interviewer, interviewing our young career participants and getting to see what they had to say about all of our research questions. Kevin, do you want to talk about our recruitment?
Yeah, absolutely. So for recruitment, we decided to go to HILM Health centers, post up posters, do targeted ads on social media like Facebook, Instagram, Tumblr, and also advertise through Totally Outright. There has been a bit of a slow recruitment when it came to late spring, early summer. Our sample are gbMSM who are between 15 to 30 years of age using or considering PrEP.
So today we will be presenting some preliminary findings. So we're currently still doing data analysis. It's actually a really exciting time to actually be able to share this with you since we're really interested in gaining your feedback as well. While we were presenting the quotes, these really illustrative sort of gems of these quotes, it'd be great to kind of pick up on your feedback as well and maybe explore some of the themes that you're finding in addition to the themes that we've already identified. So there's lots left to do. What we've highlighted here are sort of the 3 research questions, again, just to remind you as we go through them. So we've kind of organized the quotes by sort of research questions, then we've identified some themes within them as well.
So to start, we had our first research question of their experience accessing PrEP at HIM. And one thing that we were finding is we saw this really huge divide between people seeing their GP as this traditional, I go there when I have the sniffles or I broke my clavicle or something, but then we see people going to HIM and they see that as their exclusive provider of sexual health information and when they need sexual health advice and getting sexual services. And then we also saw we also see the barriers to accessing PrEP. And some people, they don't want to go to him, and they choose to go to their GP instead. So one of the quotes that we found really interesting was this first one where they said, no, I found that doctors or healthcare providers that we were exposed to growing up were for checkups. They weren't for like asking questions about your sexuality or anything like that. Another quote referencing one of the barriers that they're finding is that I live a couple blocks away from my family doctor and I already know him. It was just the easiest way to get it. Like him is on Commercial or downtown and I don't live in Commercial downtown. Like I knew if I just presented the case he would give it to me, so it was convenience. And then our final gem for this topic was the interviewer asking, how would you rate your experience of going to the HIM centers? And the participant saying that maybe increased availability would be great because every time I want to make an appointment, you always have to call like a month in advance.
So moving on to the risk section, it was actually very interesting to analyze the data and see that there were actually some recurring motifs in what the participants told us. We found that basically we have some preliminary findings, and the 3 ways in which PrEP affects safe sex practices is first, decreased condom use. So some of the participants, actually quite a lot of them, felt that there was a significant decrease in condom use, and people seemed to, well, not everyone, but a lot of them seemed to find PrEP as a substitute for condoms. This was primarily because they simply believed that condomless sex was more enjoyable for them, and it was simply more fun. They also felt they were more liberated now, so that was a positive attitude, that now they're more trusting and more willing to experiment. However, this led to the second point on the slide, which is engaging in greater risk behavior. So people were simply more willing to experiment now that PrEP was available. They felt that since now they're protected from HIV, they could engage in different sexual practices that they might not have engaged in before. Some of them even felt like they were now invincible and they can do whatever they wanted. However, there was a different cohort of people who found that PrEP was simply a good and an additional safety measure to condom use. These people very often were in a relationship at some point with someone who was HIV positive, which also means that PrEP, perhaps we could say, makes HIV positive guys more, that people are more willing to date HIV positive guys, which I think is a good thing. We actually have some interesting quotes for you.
Yeah.
Oh, sorry.
So the final sort of analysis that we did just to begin with, and again, this is initial, it's not comprehensive and doesn't cover everything that we've sort of found in the data, but one of the sort of side benefits that I personally find really interesting is that we know that PrEP is prescribed as a prophylaxis for HIV, but one of the sort of happy side effects is that a lot of the guys in our sample were reporting improved mental health, so decreased anxiety around sex, sexuality, HIV in general, and that their overall well-being had increased as a result of being on PrEP. Again, it's really hard to say, is PrEP the cause of that, or are they just, exploring more of their sexuality and maybe over time it's just sort of helping, but I think it's worth exploring because mental health is such a significant issue in the MSN community, as is obvious by a lot of the presentations this week.
I would also like to add that one of the participants actually mentioned that they had a bipolar disorder, and that by having PrEP, it actually makes them feel more safer when they have some erratic sexual practices. So they felt that this was a great additional safety measure in their everyday life. We also have some quotes. So the first one, connected to the decreased condom use, the person said that, I think the usage of condoms has declined dramatically, and whatever studies show that it's not, I don't believe that. So it's very interesting that this person in particular questions the studies that were made. But I also hear from a lot of people that this is in fact the case, that the condoms are being less and less used. And this is a particular gem. So with PrEP now being so readily available, I think the act of having condomless sex and with the fear of HIV removed makes the experience much richer. Because you're able to really just enjoy each other's company and have sex in all the good ways there is, like messy and dirty and wet and juicy, and enjoying that without needing to be afraid. So let that sink in. This was what was also mentioned, and Justin and me mentioned, that some guys felt that now they can be more themselves, they can be less afraid, they feel more trusting, and they can enjoy sex more as well. And last set of quotes is related to the guys who saw PrEP as just an additional safety measure to using condoms. So one of them said, "I've certainly had lots of encounters without a condom. I just feel that now I'm starting to value myself and feel worthy of finding a partner who cares about protecting both our sexual health." And another one, "Engaging with one preventative measure makes engaging with other preventative measures a little easier or more likely." So this was sort of like a different approach, a different take on PrEP, which I felt was important to add.
So one thing we wanted to get at in our interview guide and through questioning was, how important is PrEP in your life? Whether you are newly taking it or whether you had been previously exploring it before it was publicly available. And I think a couple of the guys that we interviewed had either had a meeting with a doctor but hadn't started taking PrEP, but had sort of started that experience. And so we wanted to know, how important had PrEP become? And one of the participants said, "I think prior to taking it, it wouldn't have been that important. But now that I have had it, had sexual experiences while on PrEP, and have become a little bit more open, if you will, with my sexual practice, I think trying to go back to how I was having sex before would be very boring, if you will, and very just like not fun. Now it's kind of like, if I'm at a bar and I think a guy's cute, I won't even think about the risk anymore. Risk is no longer a thing that factors in my decision making. More so, it's about, do I find this guy attractive? I care more about the person in the moment than I do about potential risk from that." So we can see that, one, this person had identified the fact that they didn't think they needed PrEP or that it would be that important, but now that they had gotten used to it in their life and their sexuality and things like that, they would be really hard-pressed to go back to a life without PrEP. And I think that's something to keep in mind, especially in terms of policy and things like that. This person also expressed and used a lot of the word fear. So fear kept coming up among a lot of the guys, and we talked about anxiety and mental health. This person said, "A little of the fear is gone right now. Like, I don't have the fear anymore." This was kind of juicy. "I feel like a person who's had clean drinking water and then had to go boil his water before drinking it, kind of thing. Like, it's just different, So the fact that this person felt liberated in the sense that they weren't needing to either use protection or worry about using protection or maybe take extra precaution, they felt like it would be really hard to go back, almost like not having clean water. And in terms of access, this was pretty illuminating. Quote, "I wanted it PrEP immediately. I have pretty bad anxiety about things like that. And there's a pretty intense stigma around getting HIV. I wasn't really concerned about the physiological effects, but the social effects and the stigma of HIV. And so I've always been kind of anxious about it. So the second I learned there was a pill that could make me not ever get it, I was like, I want it now. Where can I find it?" Yeah. One thing I want to point out about all of these quotes is that these are the individual's personal experiences, and so obviously the veracity or the validity of any of the information that they were providing us during the interview was really just their interpretation of what they had experienced through this entire process. So we don't want to perpetuate stigma around HIV, but these were the attitudes of some of the participants who gave us their time.
Thank you, Justin. So now I will be going into what our sample has said in terms of where they want to access PrEP. And so going with the theme that's been said so far is that there's quite a bit of preference of going to the Health Initiative for Men because of specialized knowledge and services that they provide. And there's a perception that HIM is a more sex-positive space, whereas a general practitioner's clinic isn't. That isn't verbatim by any means, but going through the interviews that we've conducted, a lot of the participants talked about shame in having to disclose any sort of sexual information with their general practitioner if they have one. So obviously that goes into the second point, which is reluctance to go see their own GPs if they have one, or even if they're thinking of looking for one, because they're seen as having limited queer competency and awareness of PrEP. So unfortunately, that leads to misinterpretation and misunderstanding to accessing PrEP. And so we're going to go through some of the quotes now that some of our participants have said in relation to how they decide to access PrEP. So Dexter says, "I think if family doctors knew what it was, if there was a way that such a thing could be communicated to family doctors and GPs, because mine looked at me like glazed eyes." So obviously, as a patient, if you're going to go see your doctor, you would like them to have some sort of information on a prophylactic that you're interested in. And so to have someone say that their doctor, or they feel like their doctor, would look at them with glazed eyes isn't such a positive experience. And Tom says something of a similar effect. "Gay health in general is not very well taught in medical school. The HIM clinic, just being an area that specializes in men's sexual health, I felt like I could be more informed rather than just going to my doctor, because he probably knew the same thing I knew." And our participant, Kevin, here, I think really illustrates the misinterpretation or misunderstanding of when it comes to information regarding PrEP. He says, "I did think that the process of actually getting PrEP was a little unrealistic, in the sense that they wanted me to get blood work done and then abstain from sex together for about 3 weeks before I started taking medication. And I was like, I'm taking this medication because I'm at risk, high risk, which means 3 weeks of no sex is probably unrealistic." And so, we went through the eligibility criteria in the Center for Excellence's website, and actually what Kevin was referring to was this specific point, which says documented negative 4th generation HIV/AG/AB test within previous 15 days of application. So I think this really speaks to the work that we as a community have to do in terms of being mindful of our language when it comes to communicating to our intended audience. And I mean, also to talk about the fact that most of our sample are university-educated young gay bi men, if it's hard for them to decipher this kind of messaging, it'll be harder for other people to decipher that as well. So I think we need to be going into a route that really takes into consideration relatable processes of knowledge transfer. And so just to go off on that, we will be talking about reflections on the process. Jeff?
Yeah, thanks guys. So that was like a lot of data we just presented, some great preliminary findings, some really juicy quotes, and we're really looking forward to spending some more time to further analyze these data and come up with some more refined themes as well. For now, though, I thought it'd be really interesting to just step back and think about and spend some time reflecting on the process of community-based research that we just undertook, and maybe offer some recommendations for maybe folks in the audience who might be interested in doing some qualitative community-based research as well, and just sharing some things that we learned. So one of the things that came out was this idea of doing research as an insider versus as an outsider. So obviously we're all young queer guys interviewing other young queer guys, which presents a couple of both challenges and opportunities. So both Kevin and Justin participated in the primary data collection, so I kind of wanted to offer maybe both of you guys to speak to what that was like interviewing other young queer men. Yeah.
Mm-hmm.
Yeah, so I think we had some different experiences. Obviously, it depended on who we were interviewing and maybe their perception or interpretation of us as community researchers. I actually found that the folks that I interviewed were incredibly candid, at least in my estimation, especially when it came to questions about sexual behavior, drug use. Like we said, we asked, how many times in a week do you use a certain drug? And there's like 30 of them, and we asked them point blank over and over. And I found that all of the guys were really open and considerate, and I felt it was sort of a benefit to be involved in community research, study the community that we are also a part of. I think it created a safer space, but we all had different experiences. So I'll let Kevin talk about his.
So Justin talked about how, it was an opportunity for him to have that insider experience, and so I think the data collection for him was a little bit easier in that sense. But I experienced a different situation wherein a participant seemed really apprehensive in communicating to me. He kept looking towards Anna, our principal interviewer, instead. So I don't know, maybe it's because he didn't like the way I looked or whatever, but I perceive that there may be hesitation of disclosure due to proximity of our relationships in the community. So I think that's something to go along the lines of, oh, hey, you're a young gay guy, I'm a young gay guy. What if you then go around and spread your business around in our community? So I perceive that that might have been it. So that was my little uncomfortable or outsider experience within doing this research.
And talk about insiders, we did literally know some of our participants, which is a nightmare for ethics. Obviously no one interviewed someone that they knew, but it did happen, they're crossing paths. It's hey. So anyways, kind of funny that we were truly insiders interviewing members of our peers about this topic.
Some more reflections in regard to the analysis. So I've never done qualitative research, and this process was very exciting because I got to learn a lot, and especially working with the team at UBC, it provided an opportunity to get an insider's perspective at everything involved in the process. So from designing a survey, the questions, an interview guide, the coding, the technical aspects, and all of those things. That being said, as much as I found it a really valuable learning opportunity, there were things that I found very frustrating because I wasn't used to qualitative research. So I'm very used to the numbers, statistical analysis, and all of those things. And so because we were just working with data extracts, and there's ethics around where you can access the data, how much we can see, where we can read it, and things like that. I found that a little frustrating just because it didn't give the whole picture, and I like sort of having that forest and the trees, and sort of being able to pick. And we weren't directly involved in the coding of all of the transcripts. We learned about the process, and we were involved in sort of designing the process, but the actual coding was done by the team at UBC. And there were times when I sometimes felt like maybe things might have been left out or would have been coded differently by other people. And I think that's just a result of being unfamiliar with the process and also not having access to entire transcripts at a time.
That's right. There was also, of course, the time concern. We simply didn't have enough time to code it ourselves. We only meet once a week for 2 hours. So, and that was also sort of a limitation for analyzing the data, even though that was phenomenal from my perspective. I loved reading and analyzing the data and finding the patterns, but it was quite hard to do because we had to access the data at the CBRC office because of the privacy and ethics concerns. And again, that was it just took us quite a long time to go through everything if we're just doing it once a week. Yeah.
I should say, though, shout out to the team who did all of the hard work in the coding, because data entry and coding and listening to all those transcripts and transcribing them is a huge deal and a lot of work. So we are very incredibly thankful for all of the work that you put into it as well.
Yeah, this is no shade here. This this isn't shade. This is just our reflections. So just wanted to maybe just finish with just a couple of thoughts about some recommendations for other qualitative researchers interested in engaging with community members. So obviously one thing that came out that was already talked about was sort of like this idea of data storage. So how can we maximize access to data for our co-interviewers, our peer researchers, without compromising participants' privacy? So often our peer researchers are going to be maybe outside of the organization where you're doing your research in. We might use our own personal computers. I mean, we all don't have work laptops, right? We have 2 CBRC laptops that we can use, but that kind of limits how we can access the data outside of the office. Also, we're all volunteers as well. So these are all just really important considerations to have when we're thinking about putting through ethics applications and working with our peer researchers. Like, how can we really try to maximize access to these data, as this seemed to be something that really stood out to us as being really important to the process. I think a couple of the guys also mentioned maybe having access to audio recordings. So instead, maybe if we can't offer full transcripts, maybe having audio recordings like a podcast sort of thing to listen to a transcript or an interview on the bus. That could be a good idea. And also, or Kevin, do you want to speak to the last point?
Yeah, completely. So to add to Jeff's point, really want to stress recruitment that goes beyond our own circles. And because I think there's so much research fatigue within our community, it's almost like preaching to the converted. And I think that really speaks to the experiences that our investigators had when it came down to having to recuse themselves from doing interviews because they personally knew the participants. So, I think a consideration that we really should be mindful of is being intentional in creating recruitment methods that are really needing to tap into underrepresented groups in PrEP research. And I think that with that being in mind, hopefully the results that we'll get will be more enriched because of the diverse participants that we'll be getting from that.
So, as with every study, there's always going to be limitations. And as much as we all really like the awesome quotes that we were able to pull out of our study, we can't really say that there's any particular trend so far because we're really limited by our sample size. We weren't able to meet our goal so far, and we're going to continue to try, but we're really limited by our sample size so far. And our other big limitation is that it's not really representative of all of Vancouver or even all of British Columbia or of any population really, but that's just the way it goes.
So we're wrapping up, so promise. So this is just a couple future research directions. So we're going to be completing data analysis. We're also going to be continuing data collection, and we have a planned collaboration. So there's lots of folks doing very similar work or synergistic work. So we're really excited to work with Nate Lachowski and his team, who are also doing some interviews with young queer guys and service providers accessing PrEP, kind of looking at similar ways that guys are referred into PrEP and sort of these clinical interactions and looking at this Jiri Score. So we're going to be continuing data collection with his team. Also really exciting is that the investigators here in Vancouver have an Engage grant that's starting up just this month actually, that's again, this idea of research from start to finish, kind of leveraging these findings and actually creating like a health promotion tool to help empower young queer guys to access PrEP through their primary care providers. So looking at these themes that these guys identified as being maybe potential barriers, trying to think about how we can address that and really taking this idea of participation at every step all the way to its logical conclusion, which is actually getting those results into the field and translating these findings into action. So that's all we got, folks. Thank you for listening.